Okay, so it was good morning. Now it is good afternoon. I want to welcome everyone to Supporting School Mental Health in Uncertain Times. My name is Andrew Ecker, and I'm coordinator of the Guidance and Child Study Center at Putnam Northern Westchester BOCES in Yorktown Heights. I am currently in my apartment in New York City. So it's so good to see you all today. I'm joined by my colleagues Pat Baru and Amy Malloy, and I'll just ask them to wave, and we can all say hi to everyone. At a time of social isolation, it's really great to see so many faces, and we hope that this is a helpful meeting today to see some people, to connect, to learn some strategies or some resources, to share some things, and we understand that this might be a starting point, and that going forward from here, we're here to support you as best as we can. I'm also new to Zoom, so I apologize in advance for any technical issues on my end. Everyone who has joined the meeting has been muted just because we know that background noise can sometimes be a challenge. Additionally, this is being recorded so that we can share this with others going forward. I'm already trying to figure out how to advance the slide and not able to do it. Okay, I hope this is working for everyone. We have three goals today. We want to discuss and also anticipate the pressing needs of our school communities as it relates to mental health and wellness. We want to suggest some resources and have an opportunity to check in with each other on what school leaders, staff, clinicians are doing in the space of supporting mental health at this time. And just to start off, I want to thank you. Thank you for being here. Thank you for everything that you are doing during this time. This is a pandemic and this is a crisis, and that's very real. And I think that as school leaders, we all deserve the opportunity to be vulnerable and to recognize that. So if for nothing else, during the next 30 minutes, we can give you an opportunity to be thanked, to be recognized for all that you are doing, to think about your own wellness, then I think that would be 30 minutes well spent. We want to start off with some self-care and the ABCs of wellness. And as so many of you are working 7 days a week and around the clock, we thought that it would be a good time to check in on our awareness, balance, and also connection. So following this, we will share lots of links, resources, videos, apps, things like that. But real quick, when we talk about the ABCs and awareness, balance, connection, we're first talking about awareness of ourselves and our own emotions. There's so much that's happening right now in terms of COVID-19 itself, the actual pandemic, our work lives, things at home, which are now physically happening in the same space as work and home life. There's loss of life, there's loss of our routines. People are experiencing financial insecurity, loss of jobs. There's additional stress that's placed by that, loss of routines for kids, connections with family. So we want to recognize that and be aware of that. And there are strategies in mindfulness and journaling, meditation, being grateful and really expressing gratitude throughout the day, and things that we can do to maintain our awareness during this time. The B is for balance, and to ensure that especially in the challenging times, that we have balance in our lives. And this includes physical balance, things like exercise. I'm definitely finding myself walking around the apartment a lot to ensure that I'm getting my steps in, but things like physical activity, trying to find time for play, hydration, keeping a schedule that includes a break from work and from turning off from the news, keeping a schedule for sleep, things like that. And then in terms of our connection, being really intentional about having connection with others, with our families, with our friends, social circles, seeing people smile. I want to just smile because it makes me feel good, but want to ensure that we are having connection with others during this difficult time. So actually we were talking before we started about if we should have our faces up on the screen, or if we should just do the PowerPoint. We said, no, we really want to see people. We really want to connect with others, even if it's virtually, so we can see others and have the human connection that we need so much. So I'm going to turn it over to Amy Malloy from Mental Health Association of New York State.
Great, thanks so much, Andrew, and hello to everyone. It is definitely good to see some faces, and thanks for taking the time today. I know you all have a lot on your plate, so I'll get right to it. In thinking about sort of the purpose for this forum, we've had some conversations about some of the concerns, issues, challenges that are coming up specifically around the mental health and wellness of students, their families. So I don't know about you, but for me, and certainly I know this is partly because we're at the Resource Center, but we're getting inundated with ideas and resources and webinars and lots of different things to do to support wellness. But I think the challenge then becomes, how do we communicate that to our school districts and to our families and to our students and to our staff? And I think, some things maybe to talk about are just thinking about what is most relevant for your community, given your population, given your student needs. And then certainly, how do we deliver that information? And that I'm really interested in hearing what schools are doing around this. How are you getting some of this information, resources, mental health support resources to your staff and to your families? How are you utilizing your student support services staff, your school-based staff? Are they doing things different than maybe they would have done before? Certainly given the online experience. And that includes your school nurses and your library media specialists and your technology specialists. Really interested in thinking about how we can do that in a way that is most sort of efficient and not too overwhelming. I was speaking with a school counselor not too long ago and was asking that very question, and she shared how she's been collecting resources and putting them on her Google Classroom for the students that she works with. But then we had a conversation about the other staff, and if I'm an ELA teacher, I don't have those same resources available to me, but wouldn't it be great if I did and I could share that with my students, because maybe there's some students in my ELA class that are not on her caseload and could really benefit from that. So then we began to have a conversation about how can those school-based personnel support students all across the district. And then I think the other thing too is that it's not too soon to start thinking about how do we support students upon reentry. It may be longer than we hope for it to be, but I think that's going to present some additional challenges too. Kids are going to come back to school, if not in May or June, and in September, as Andrew said, with some grief experience, grief and loss, certainly some anxiety just around being in public spaces. So how do we prepare for that? And this is probably a good time for us, I think, to start thinking about that as well.
Thanks, Amy. I'm just going to jump in because there was one thing that I didn't mention at the bottom of my previous slide, which is actually, I think, fits in well to what you were just saying about the reentry plan. And when we think about what we're doing at this time, this time is new, and this is a new crisis and a new challenge. However, the structures that we know to be effective as a framework are still effective. So when we think about a multi-tiered system and what we do for all students and for all families and for all of our staff, that still works. And we think about what we do for some students who need additional supports. And then when we think about targeted supports that are individualized, that framework, no matter what the context is, that framework still works. So we included this at the bottom just to think about, while what we're doing is new, we can still use a multi-tiered approach to any of the interventions or things that we're doing for our students, for their families, for our communities, and for our staff as well. So what are we doing for all, what are we doing for some, and then what are we doing for individual? And we know that when we add on interventions, that they're never in place of. So when you are getting what is for all students, if you have anything that's added on top of that, it is not in place of what is there for everyone. It's only in addition to that.
And I think, hello, everybody, Pat Brew. And I think the place where we talk about suicide safety and, mental health crises in those individual students is where I kind of have been spending a lot of my energy and thinking about and wondering about, because I think it's different from community to community. How much have your mental health services and mental health crisis services been impacted so far by the COVID-19 crisis? And so I really wanted to spend a little bit of time talking about the resources that are still available and some thoughts you might want to have around this if you don't already sort of know this. One of them is that the regulatory sort of framework for telemental health, that a lot of the regulations have gone away to make it really, really easy for mental health providers to be able to provide telephonic support and to bill for it at this time. So some folks who may have had to show up at a clinic or show up at a provider's office may now be able to access supports by telephone. Really helpful to, give some phone calls to providers to know sort of what that status is. Those are, of course, vital services, so they are available, and they continue to be available. They're also available to our staff and to our families, a crisis text line, which is a text to the phone number 741-741. Someone can just text the keyword got5 and they can reach support service folks. And the suicide prevention lifeline is 1-800-273-8255. As far as, if your school folks relied on 911 or on mobile crisis services in the past, it would be really good to check on, on your protocols and on what people think they're supposed to do if they come across a student who's in crisis in interacting with that student from home. And to make sure, that if it's mobile crisis, if that's still going to work, and whether or not, if 911 was sort of the fallback before, is it more likely that we're going to have to rely on these telephone services? The other service I wanted to make you aware of is that the New York State Office of Mental Health, Governor Cuomo's initiative has set up emotional support line, a COVID-19 emotional support line. It runs from 7 a.m. to 10 p.m. Every 7 days a week. And the number is 1-844-863-9314. We have sort of flyers for that. We'll be having more information coming out and posters and other kinds of bits of information and tip sheets coming out from our office in the coming week. I, like Amy, have been in the same sort of position where we've received lots of, we just are inundated with lots of resources and want to think strategically about how to offer those in a way that we're not just bombarding people's our inboxes, but giving you all and helping you all with the resources that you need in a way that they're digestible and shareable with your school communities. So I think that's about what I had here.
Thanks, Pat. I just want to jump in, and I also want to reply to a message in the chat. So thank you, because I did not mention this, but these slides are going to be emailed out afterwards. There's also many more resources that will be coming with that as well. One example of the resources that my colleague, Dr. Lopez, and I have been working on, we have not yet posted to our website, but we do have that as a PDF. So you are going to receive maybe too many resources, but hopefully they're all helpful. And one of the reasons why we wanted to start with central administrators is we also know that during this time, we didn't want to miss anyone. So we know that many people in school systems are wearing many hats at this time. And we thought that by starting with our central administration, that would be a great way that you would know who to contact. So if the resource isn't going to live with you, that at least it could get into the right hands. One of the resources that will be shared is specific to social emotional learning, wellness, and mental health. And we know that at this time, as I said, we're all wearing so many different hats. So the resources are for families, they're for self-care, they're for administrators, students. We tried to include as many resources in Spanish and English and other languages. As well, there's a resource specific to guidance, counseling, and special education, and another resource on equity and inclusion. And these will be updated going forward. I know that other topics that people have reached out about, and it's certainly a very big need, is the rise of addiction and also domestic abuse that occurs in the home, especially during this time as this continues. So those are two areas that we are working on for adding to the resources, but once we have you included, we will be sending you those ongoing. So before we wrap up, this would be a time where we can unmute the group and ask that if there are specific questions that you have that you can share them. You can also enter them into the chat. We can try to give the best guidance that we can at this time, but we really also want to be here for you going forward. So I'm going to try to toggle and unmute all here. But if you do have a question during this time, I also encourage you to put it into the chat because we can see that for everyone. I might have muted everyone instead of unmuting everyone.
It's good now.
Okay, good. I think it would be good to hear more about crisis services, right? WJCS. No.
I would be interested, I think, in just hearing from folks either through the chat or if you're unmuted, as to what are some of the, I guess, strategies you're using to continue to identify students and support students.
You can't put the eggs in here. Now, Daddy,
So people might be unmuted now. So if you are not speaking, I would encourage you now to mute yourself.
I work in a school-based mental health clinic in Peekskill.
Pretty
We're
good.
continuing to provide telehealth services to our children in the school building, as well as reaching out to past referrals and accepting ongoing referrals should they come up, as well as availability to the staff within our buildings if they need support as well. But a lot of the support has been linking them up with, food resources and things like that in their community, because they're really struggling to provide for the children in the home. But the district's been wonderful with providing 2 meals a day to all the children in the district so far.
Yeah, I went to high school in Westchester. I'm Pat Bragdon. Hi, everyone. Nice to see everyone. We are reaching out in our case goes, the mandated kids through special education and also our building level kids. We continue to have Zoom meetings and team meetings, a little bit more time consuming and to go through the control during all this, you know, I use that phrase, I have to go through because that's what it feels like. I'm encouraging the administrators to begin to think about what was mentioned here is the transition back. I'm working with a lot of kids who are very stressed because I think the teachers and the districts are still trying to figure out the amount of work to give. So there's been a time where kids have been trying to figure this all out. There wasn't a lot of time for them and their families to transition into this. And that's caused a tremendous amount of stress when we think parents now who are home, they are working, many of them out of the home, teachers too, yet they're working their job and it's multitasking to the 9th degree. So it's causing a lot of stress. I'm finding, especially with our seniors who are grieving so many loss of things that they were looking forward to. You know, it seems maybe insignificant to the adults, but to the seniors, it's, you know, they've waited their whole lives to have their senior prom and their graduation, and now all of that's kind of up in the air for them. In addition, some of our students are the only ones that are working at grocery stores and are the main economic support for their families. So, you know, a tremendous amount of stress unknowns. I encourage as much information as can be shared, constantly be shared, because I think once we get that information, it gives us something, a lot of no control. So focusing again on what we can control. I'm sending out a weekly SelfCare to staff to care themselves. So that's kind of some of the things that are going on from the counseling aspect of.
Thank you, Pat. Amy or Pat, do you want to piggyback on any of that? There's also a question from Jim Magnello that I wanted to get to. Pat, I think maybe you could. So first for feedback for Pat, and then maybe to Jim's question after that.
Sure. Yeah, I mean, I think this is going to be a piece of the picture that we're going to see more families that have struggled with loss, and how do we help when we can't participate in our normal rituals of you know, going to see people and take care of people, and then we have kids who have lost as well. I know a couple of tip sheets have come across my desk in the last couple of days, and I do know that folks are sort of adapting more kind of tip sheets around this work, and so I'm happy to share those and link those to the resources if we can in our follow-up email. You know, I think helping school communities, I think we're gonna have to be able to send letters and notes and connect in ways that aren't, you know, going to the funeral home, right? Like we might normally think to do for our students, and do that on an ongoing basis. But I'll make sure I send some resources, and I'm really sorry about your loss. It's
Thank you. There's another question. This one's from Brett Harris. Are school staff recognizing problems among students, and are they communicating that with you?
Is that question for me, Andrew?
I think that was for the group. Amy or Pat, do you want to?
I actually think that's a really great question for some further dialogue, because I think there's a lot, there's different ways that schools might be doing it. And I'm curious if the situation, given that people are not in the same building, how have your protocols changed? Are you encountering any new barriers? And how have you kind of made some changes or adjustments to overcome that? So yeah, I think that's a great question for anybody interested.
Something that is not an answer to that, but just I know that schools have encountered from informal conversations this week. We know when students have counseling. We know if a student has a 504 plan or they have something where they're being seen. But for kids who we normally relied on informal communication or having eyes on a student because we see them in the hallway, how do we ensure that we are seeing those students now and checking in on them? And one of the challenges that someone reached out with was, if students reach out to them by social media or some other way, where kids used to see them in the hallway or, be able to just pop their head into their office, and now they're reaching out to you in a way, what kind of response can we give for them? So we're thinking about, again, all the students, what are we doing for all students, what are we doing for some, and do we know that we have, if there's any student who we might have a concern about, what type of a protocol do we have? And that's, again, why we wanted to start with our central administration, because individual counselors might know what they're doing, but is there a district plan in place to ensure that we know about the well-being of all our kids? Oh, and also my colleague, Dr. Lopez, has a great point about districts checking in on putting protocols for mental health counselors to be kind of on at certain hours. So that's what some districts might be doing, and others that's not possible because there might only be one mental health counselor. That mental health counselor might be having a challenge themselves. So there's different things that are happening, obviously based on the size of districts and what resources are available. But I think the most important thing is just knowing that as a district, we have a plan for this and that everyone knows what our role is and what those protocols are.
Yeah, and I spoke with a school counselor in Central New York recently who said they created a Google form and they just made sure that was shared with all of their families, so that if they were looking for help and support, that was one way to contact the school, connect with the school, and then they could triage from there. I think that is sort of directed from families to schools, but I think the idea of checking in on every student is wonderful. I don't know how practical that is for some districts, and love to hear about strategies that seem to be working. I think when we set up this forum, we talked about what a great opportunity that would be to identify some of those strategies and share them with others.
One of the things that we've done is every teacher is responsible to reach out to students. And if they don't hear from them, they then contact either a clinician and the counselor, and then we follow up on it. I know there's been a few where we haven't heard from students for a few days, and then talking about next steps. Do we do a wellness check if we have concerns about the student, etc.? So that's one of the things. And as a result of that, some families don't have the internet, they haven't had computers, etc. So, we're walking a fine line with doing wellness checks too, because I just need to be cautious about that. But we are trying to be in touch with every student. Yeah. Which have been really great if they haven't heard from to let us know.
Thank you, Pat. I just want to add, because I know we're coming up close on time, that if you have a question or a comment or a resource or something that we have not addressed yet, please continue to put them into the Zoom chat and we will get back to you maybe by email or something, but we want to connect with you. So if you haven't had a chance to get to your question, please put them all into the chat and we will certainly get back to you. There was a final question around a resource when parents are hospitalized and children test positive. So again, I think these are great questions, and I don't know per se about that. Amy, I see you nodding, but if you have questions, please continue to put them in there and we will share them with the group and when we share the resources.
Great.
And one other question. Thanks, Phil. Yeah, so please continue. We will get to all these questions and we might follow up either individually or as a group. We want absolutely to get to each of these. So as we end, I just want to thank you all again for all that you're doing for your students, for your communities. I think just really tremendous how you are coming together this time, and we appreciate your time this Friday. If there's anything that we can do going forward, please feel free to reach out to us. And we wish you all the best in health and wellness and safety going forward.
Thank you.
Take
Thank
care.
you.